Chronic inflammation might be trying to kill you. It is thought to play a role in conditions that account for more than half of global deaths, perhaps contributing to the development of things like arthritis, cancer, Alzheimer's, diabetes, chronic respiratory illness, and cardiovascular disease, including stroke and heart attack. Inflammation is real, but what causes it? And what is it? And how is it affecting your health? But more importantly, what can you do to protect yourself? Healthy isn't just what you do, it's who you become. I'm Dr. Vickie, and this is Healthy Looks Great on You, a lifestyle medicine podcast to help you reclaim your energy, your focus, and your well-being. Life tested, doctor approved. You probably have an idea about how inflammation feels in your body. Inflammation can show up as fatigue, pain, swelling, stiffness, bloating, moodiness, brain fog, skin issues, and just plain feeling blah. But inflammation can also be deadly, so it's important to understand the process and treat the underlying cause. Here's a familiar scenario. Someone makes an inflammatory comment and it makes someone angry. And their face turns red and their jaw tightens and their eyes narrow. Now, hold on to that image because inflammation in the body on a cellular level isn't all that different. There's a trigger, then an angry response, which is sometimes appropriate and sometimes an overreaction. Let's go to mini medical school and sort it out. Inflammation is not a design flaw. It's a defense system that helps protect your body from things like infection, injury, and toxins. And let's just lump all those things together and call it an insult. Not the yo mama kind of insult, but the cut, the splinter, the chemical, the virus or bacteria that triggers an immune response. Once damage has occurred, your body calls in the troops, macrophages, mast cells, dendritic cells, and these frontline defenders release chemicals to activate a response. Things like histamine and bradykinin and cytokines. These are immune mediators that cause blood vessels to open up and dilate because blood carries almost everything needed for your body to heal, except chicken soup. Now, remember the picture of the red-faced, offended person? Well, all that blood flow is what causes the redness and warmth in both situations. But what happens next is really fascinating. You see, the cells that line the blood vessels contract, and that creates these little gaps so that fluid can leak out, and that's what causes swelling and pain. The medical term for this protein-rich fluid that comes out is exudate, and it promotes healing unless there's too much of it. You know, it's okay to have hard conversations, and sometimes we even need to debate things like politics and religion. But some people cannot control their temper, and things get out of hand. And the same thing can happen with the inflammatory response. We are indeed fearfully and wonderfully made. And short-term inflammation is protective. It promotes healing. But this low-grade, continual inflammation is more like a grudge, and it can smolder for years before the damage is evident. You see, bitterness in someone's heart is evidenced by the words that come from their mouth. But what are the markers for chronic inflammation in your body? Well, since you asked, C-reactive protein and erythrocyte sedimentation rate are the most commonly measured. But if you wind up in the cardiologist or oncologist office, there are others like interleukin-6. But you're here to stay out of the specialist office, so let's see if we can diffuse low-grade chronic inflammation with the 6 pillars of lifestyle medicine. Each one of them plays a role. Nutrition, exercise, avoiding substances that are harmful, controlling stress, connecting with others, and especially sleep. Sleep is like the sentinel guard for inflammation. You see, A lot of work goes on while you sleep. While you're getting your Z's, your body is regulating all things related to your immune system, like cytokines. Without sufficient restorative sleep, those cytokines overreact. Yeah, I do the same thing when I haven't had enough sleep. And like the hothead who blows his lid, cytokines and other pro inflammatory molecules cannot regulate the immune system properly. This is what can result in chronic inflammation, which is why poor sleep is associated with an increased risk of high blood pressure, high cholesterol, heart disease, stroke, type 2 diabetes, certain types of cancer, mood disorders, dementia, and obesity. And if you're having trouble sleeping because you can't turn off your mind, I have a great resource for you on my website. Just go to healthylooksgreatonyou.com and look at sleep solutions. I'll drop a link in the show notes so it's easy for you to find. It really works for turning off those racing thoughts. Stress is another contributor because chronic stress leads to chronically elevated cortisol and adrenaline levels. And that contributes to chronic inflammation and increases the risk of obesity. Your body needs to respond to toxins to keep your body healthy. So things like tobacco and alcohol and other substances trigger the immune system. And alcohol is a significant driver of gut inflammation, liver inflammation, and systemic inflammation. And when those exposures are chronic, the damage is magnified. Now let's get out of the classroom and move to the table so we can dissect a single substance that can cause neuroinflammation, gut inflammation, joint inflammation, cardiovascular inflammation, and metabolic inflammation. Want to guess? I'll give you a hint. It's also a major contributor to obesity. It's easily available, addictive, and aggravating. Did you guess sugar? Chronically elevated blood sugar levels result in advanced glycation end products, which is called AGEs, and that causes oxidative stress. In other words, repeated sugar exposure and repeated insulin spikes results in insulin resistance, and that drives chronic inflammation. On top of that, sugar overwhelms the liver, and that causes an inflammatory response and results in things like elevated triglycerides and fatty liver disease. Sugar interferes with the gut microbiome, and poor gut health is associated with excessive chronic inflammation. The gut inflammation axis is something we need to pay attention to. We've got all these bacteria living in our gut, and we want to feed the good bacteria so that they produce anti-inflammatory short-chain fatty acids. And what do they need to make them flourish? Fiber. But sugar causes weight gain and excessive visceral fat, and get this, visceral fat actually secretes inflammatory cytokines. They're called adipokines. It's not a lone actor, though. Unhealthy fats like trans fats and saturated fats also trigger inflammation. And artificial trans fats used to be added to lots of processed foods, but it's so bad it was outlawed. But saturated fat is readily available in the standard American diet of cheese and burgers, steak, pizza, and full-fat dairy products. And the worst saturated fats are found in processed meats like sausage, bacon, pepperoni, salami, hot dogs, and deli meat. Add a bun or a crust with refined carbs into the mix, and you've got a recipe for inflammation. And it's no wonder these diseases are so prevalent. So, what's an irritated body to do? Well, that red-faced angry person could take a walk around the block and cool off a bit. And wouldn't you know it, cellular inflammation can be calmed down the exact same way. If you want to reduce your risk for heart disease, diabetes, dementia, and obesity, make it a habit to take a brisk walk, especially after dinner. Walking has compounded benefits. Walking outdoors in nature can help reduce stress. and walking with a friend can combat loneliness. Both exercise and diet can reduce inflammation. Overall, the Mediterranean diet is best known for long-term health, and that is because it's rich in anti-inflammatory foods like fruits, vegetables, nuts, beans, seeds, and fatty fish. Foods with lots of antioxidants and polyphenols, which act as antioxidants, have protective effects. So add more of that to your diet. They're found in fruits, especially berries, vegetables, as well as coffee and tea. I don't know about you, but that is good news. And you've probably heard of an anti-inflammatory diet, and there are lots of books and podcasts to help you with that. But here's my recommendation. Choose one anti-inflammatory food to add to your diet. Now make it a good one that is high in antioxidants, and choose something that you like to eat. Don't try to force yourself to eat something you don't like. If you can, choose green leafy vegetables like spinach and kale, and you can add those to a smoothie and get a good dose every single day without even tasting it. Throw in some nuts like almonds or walnuts, and you've got a double dose already. Pack it with strawberries, blueberries, or cherries, and you're off to a great start every single day. Tomatoes, olive oil, and fatty fish like salmon or tuna are also considered anti-inflammatory. That's because they contain omega-3 fatty acids, which are metabolized into compounds that help calm down inflammation. Not only are they found in fatty fish, but also green leafy vegetables and flax seeds. Now, omega-6 fatty acids are also necessary for the body to respond appropriately, but they can also be precursors to pro-inflammatory molecules. So what's important is the balance between the two. And omega-6 fatty acids are often found in processed foods. So take a brisk walk after dinner and get a good night's sleep. Add these foods, and you're doing your body a favor. And if you're already suffering the consequences of inflammation, you might need to make some more extreme changes, but those are hard. So start with one favor that's easy that you can do for your body, and then build on your one healthy choice, because healthy looks great on you. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.